Once it's clear that a specific targeted therapy is an option for your child or for you as a teenager, you'll probably want to know how the whole process now actually works. So what can you actually expect? That's exactly what we'll be covering in the next few minutes. How such a therapy proceeds depends, of course, on several factors. On the specific illness, the goal of the treatment, and naturally, on the individual progress. But what can already be said is that targeted therapy usually works differently than, for example, chemotherapy. We already mentioned one important difference in the last video. Because the medications are generally not given as an infusion, but usually in the form of tablets or as a liquid to swallow. And this means that you usually don't have to stay in the hospital the whole time, but can simply take the medication at home. Some of them are taken daily, others perhaps only once a week. Often it's several tablets that are combined with each other. But exactly how it will be for you, your doctor will of course explain to you in detail. And you'll also receive a detailed medication plan that states when and how to take the tablets and what else you should watch out for. By the way, we'll get to the topic of side effects in the next video. Regarding the medication plan, to help you keep track, it's useful to hang the plan in a clearly visible place, like on the refrigerator. It's super important that the tablets are taken correctly so that the therapy can work effectively. And in case something is unclear or you need immediate advice, you should always have your doctor's number handy, maybe also on the refrigerator. Sometimes, targeted therapy is also combined with chemotherapy. This is usually done, for example, to further weaken the cancer cells or to prevent resistance, meaning to stop the medication from becoming less effective over time. Because unfortunately, cancer cells can be quite adaptable and can change in a way that makes them insensitive to an active ingredient. However, it's also possible that chemotherapy or radiation is done first, and the targeted therapy starts only after that. Therefore, at the start of therapy, an individual treatment plan is created for every patient. So what happens next? When your child or you as a teenager start a targeted therapy, you will also go for regular checkups at your hospital's outpatient clinic. And there, depending on the illness and medication, various things are checked, such as blood counts, skin condition, and heart function. Or whether everything is okay with the eyes. In the beginning, these checkups happen quite frequently, simply to see if the therapy is being tolerated well. That can be, for example, every 1 to 2 weeks. Exactly how often is determined individually and also depends on other factors of the illness. Later on, if everything goes well, the intervals between appointments can also become longer. All in all, such a therapy usually takes quite a long time. As a rule, it's at least 1 to 2 years. And some targeted medications must also be taken permanently so that a relapse does not occur. If the medication works well, in some cases, after a certain period of time, an attempt is made to stop the medication completely. Often, however, this only becomes apparent over time. Yes, depending on how things develop. So that's it already, and I hope you now have a somewhat more concrete idea of how such a targeted therapy can actually proceed. As I said, you can be sure your treatment team will be by your side and will go through every single step very carefully with you. And is also always there for you if you still have questions or need help.